research indicates that exercise may only have a minor impact on the baby's birth weight, but it remains key for expectant mothers' health.
So what are those best guidelines for moms to be? So many women out there looking for answers. So we're calling on our resident OBGYN, Dr. Jennifer Ashton.
Good morning, you guys.
Everybody in the studio likes having you around too, just in case.
You never know when she'll come in handy.
The 5 of us sitting on the sofa here.
Yes.
And there are so many myths about what you should and shouldn't do when you're pregnant. One of the first ones being you should avoid ab work for obvious reasons.
Right. Now, what I tell my patients is that may be true at the end when you guys are really a lot further along at the end of the second, third trimester. In the beginning of pregnancy, you actually want to do all you can to strengthen your abs, strengthen your core. They come into play strongly in labor and delivery, and the stronger your abs are in the beginning, the stronger they'll be after you deliver, and maybe you won't have that punch that most moms have.
So first trimester is okay?
That's right.
But beyond that, ask your doctor.
Exactly.
What about, you always hear that if you've never exercised before, now is not the time to start.
Yeah, I think we're changing that a little bit because we know now that pregnancy is such an important time. It really should be looked at more like an athletic event rather than a disease. So again, light exercise, fine. There are some big things you want to avoid. Any high impact exercises like horseback riding, skiing, ice skating, you want to stay away from those, but otherwise it's perfectly
You
fine.
also want to stay in tune with your body because it is changing so much. Your joints are loosening.
That's right.
So what are some injuries to look out for?
Well, the joints do relax. The body makes a pregnancy hormone known as relaxin to help your joints stay limber in time for labor and delivery. So you can have some joint and ligament strain. And also, if you're doing things on your back, you can drop your blood pressure because your uterus puts a lot of weight on your major blood vessels. So again, your balance can be off key. You want to take it easy. Don't do things where you have a high risk of falling. That's the most important thing.
So give me your top 2 or 3 do's and don'ts.
Well, definitely stay fit. The more limber you are, things like yoga are important. Cardiovascular conditioning is important. The better shape you are going into the end, the easier your delivery will be.
Dr. Jennifer Ashton.
Now drop and give me 20, both of you guys.
She's so funny.
Good luck with that.